If you're delaying medical care and not going to the emergency room when you should, the hospitals have a message for you. CBSN Bay Area's Kiese talked with a doctor from San Ramon Regional Medical Center.
Joining us now by Zoom is Dr. Joe Toscano, Department Chair of Emergency Medicine at San Ramon Regional Medical Center. Dr. Toscano, we are hearing that some patients are delaying needed care and aren't going to the emergency department when they should. Why do you think that is?
I think there are a couple of reasons. In the U.S., we looked at the experience in China and in Italy and saw that emergency rooms were overwhelmed with COVID patients. So there was an initial messaging before it hit in the U.S. for people to stay home if they had mild level of illness, so that we wouldn't be overwhelmed. I think that was a big part of it. The other part of it, and I've heard this from patients, is that some of them are actually afraid that they'll get COVID by coming to the ER.
So what's the word to some of those patients? I'm sure if they're having severe issues or emergency issues, they should still come get that treatment.
Right. I think, the kind of correct take home is that if there was a real reason you would have come to the ER in the past, you should follow the same advice. There's no reason not to come in terms of we're not overwhelmed. And then as well, appropriate protections are being taken so you won't get COVID by coming to the hospital.
And what's the scene been like at San Ramon Regional Medical Center?
Similar to what it's been like across the country, we're hearing, and that is that ER volumes are down. Patients are not seeking care for all the things that they have in the past. Probably 50% fewer patients on a daily basis.
And you mentioned those fears and concerns. What are you doing to keep your patients and staff safe?
We have an intake process now that screens patients if they're there with symptoms suspicious for infection or not. All patients are asked to wear a mask, and then the staff wears protective equipment that not only helps us prevent contamination, but as well it prevents us from bringing the infection from one patient to the next.
Safety, of course, always key. And is there anything else you would like to add?
I think there are symptom checkers online. The main question that people have is, should I go? And if you have a primary care doctor, it's still very valid and a great way to get advice to call your primary care physician if you're trying to decide where to go to seek care. Any severe symptoms, chest pain, severe headache, trouble breathing, if you think you're having a stroke because of a facial droop or bodily weakness, then call 911 and they can help you figure it out as well.
It's good to know that you're all there. Thank you so much, Dr. Joe Toscano, Department Chair of Emergency Medicine at San Ramon Regional Medical Center. Thank you.